As preparations for New Year's Eve got underway in Darwin, authorities had a stern warning for partygoers.
Tonight has the very real possibility of being a super spreader event for the Northern Territory. That should come as no surprise to anybody.
With thousands of revellers expected to pack Darwin's CBD, some in the community are exercising caution.
We're just visitors in town. Crowds a bit concerning to go out, and we think it's going to be very overbooked in other places, so we're just going to wing it.
Double vaxxed. I just hope we don't go into another lockdown if people do start catching like crazy.
Celebrations have already been somewhat dampened after the Territory recorded 60 new COVID cases overnight, the highest daily total yet, including 11 cases of community transmission, 10 of them in Darwin and 1 in Katherine. With the Omicron threat now out there, an indoor mask mandate was this evening introduced across the NT.
I know the timing of the mandate is not ideal coming into New Year's Eve, but the fact is tonight will be a social one, a night where people gather in large numbers. Unfortunately, that is why it is important we act now.
Meanwhile, concerns are mounting about the impact of COVID on the health system, with an email to staff at Royal Darwin Hospital revealing that more than 40 staff members are in isolation after another worker tested positive. And as a list of exposure sites grows to include more popular venues across Darwin, changes have also been flagged for the way they'll be listed, with people who've checked into a venue to be alerted through text messages, not the government website.
As you've seen down south, at some stage the website will cease publishing exposure sites because they grow in volume. That loses effectiveness. There is too much information for people to read.
The NT government has also confirmed it'll adopt the new definition of a close contact agreed to by National Cabinet yesterday. That means a close contact will be someone who spent 4 hours or more with a confirmed case in a household setting. They'll only have to quarantine for 7 days and will have to comply with testing requirements. Positive COVID cases will also only need to isolate for 7 days and produce a negative PCR test on day 6. Husni Shams, ABC News.